So for NG tube installation, you need 3 measuring cups, whatever your medication or tube feeding you need, and then also the flush, whether it be normal saline or sterile water. And you also need the irrigation tube and the piston, and then the measuring device, usually the tape measure there. Alright, we're gonna hand hygiene, introduce myself. Hey, my name is Cody, I'm a student nurse. I'm gonna do my 60-second assessment. I have my NG tube in place, we have trach, TLC, pulmonary. I have my bed in the lowest position, I have my ABCs, airway, breathing, circulation. Hey, I'm just gonna, can you tell me your first and last name? I'm gonna verify it with my name and date of birth. Awesome. Alright, are you in any pain right now? No? Perfect. So we're just gonna do we're gonna give you a installation through your NG tube. Looks like we have a medication for you. I just want to sit you up to at least 30 degrees. Just let me know if that's comfortable for you. Alright, so we're going to get everything ready before I actually measure and do the installation. So I'm going to open up my piston syringe. I'm going to grab it to make sure I don't contaminate the actual syringe. Put this off to the side. Alright, and I'm going to verify my fluid and the medicine to my MAR. So I have ordered for normal saline. I'm going to make sure that's in date. That is clear. Looks like it is already open, so I'm going to lip it into the trash can. Lip. And I need to get my my 2 flushes ready. I'm going to look at eye level. Perfect. I'm going to get this one over here. Alright. Alright, make sure to put my hand over the label. My flush. So I have my medicine. I'm going to verify with my MAR. I have the right one. Again, clarity, expiration. This one is a new package, so I don't need to lip it. I'm going to get my medication here. You're going to need 30 mLs. Look at it like this. Perfect. Alright, so I got those ready. I'm going to organize them, so I have my flush first, medicine in the middle, flush at the ends. Alright, so I'm going to hand hygiene again. I'm going to get my gloves on. Alright, we're just going to get your medication going, okay? That glove out. Alright, so I'm going to make sure that I'm in my centimeters. I'm going to measure from the right, measure out, and I have 77 centimeters compared to my MAR that's right there, and that is the same, perfect. So we have the proper measurement, 20 mLs. So I pinched it, I'm going to release. I'm going to inject to get the tube away from any stomach wall. While I'm still in here, I'm going to look for my 20 mL. So I'm going to draw up 20 mL of the stomach content, looking for if it's green, brown, just the stomach juices. Make sure there's no extra tube feeding, anything like that. I'm going to re-instill that stomach contents, re-pinch, reapply the stopper, place this back on the patient. Now I'm going to instill and put this back in there, making sure to stay still. I'm going to pinch this again. I'm going to apply my stopper, or my syringe rather, make sure to clamp it. I have my 30 mLs of flush. Put that down. Slowly reopen, making sure that I pinch it once it gets closer to the end, just to make sure that we don't get too much of the air into the stomach. I'm going to take my prescribed medication. however you're feeding it, maybe.
If you bring it up higher, what happens?
Theoretically, it should make it go faster, but I don't know if this will actually. But it's better to let
Not-
it go slow
yeah.
because then you don't want to have too much stomach or air go in there. So now that I instilled the medication, I'm going to do another flush right behind it. I'm going to let that one instill as well. And right before it's in, I'm going to clamp it. And all of that is out. I'm going to clamp that with the stopper. If I can put my syringe back together. Alright. So I want to leave my patient in the this position so they don't aspirate. I'm going to make sure that the thread is in the lowest position, which it is. I have the call button here. Alright, so you're all set. Just let me know if you have any pain or if there's if you feel like you need to vomit at all. But your medication is all ready to go. And then document after the fact. That's it. And then at the end we'll take our gloves off, hand hygiene, do all this, and then once we get out we'll document.